Hello, everybody, and good morning. My name is Ricardo Cabrera. I am the operations manager here at the Latino Chamber of Commerce of Boulder County. And this morning we have our guests, Christina Edstrom and Danny, and they're representing Boulder County Public Health. And we're going to talk about sugary beverage and their projects and programs they have. So welcome, Danny and Christina. Danny, tell me a little bit about yourself.
Hi, my name is Daniela Garcia. I'm 15 and I've lived in Colorado my whole life. I joined because I want to help the community and my people.
Excellent. And Christina, tell me a little bit about yourself.
Hi, I'm Christina. I grew up here in Longmont, and I'm just very passionate about improving the health of everybody in our community, but especially our kids and our youth.
Okay, so let's get to work then. So sugary beverages, why are you guys focusing on sugary beverages and the message you're trying to share?
Yeah, good question. So sugary beverages are the #1 source of calories and sugar in our diets, but unlike food, like even cookies, they provide no nutritional value at all. So it's really easy to consume a huge amount of sugar when drinking sugary drinks because there's no chewing to slow it down, and it's just immediately absorbed in our body. So in fact, 1 can of Coke has about the same amount of sugar as 16 cookies. So we know that sugary drinks have a huge effect on our health, and we're especially concerned about the way they affect our kids. In fact, the average kid in the United States drinks 30 gallons of sugary drinks a year, which is enough to fill a whole bathtub. So when we think about sugary drinks, the first thing that comes to mind usually is soda, but sugary drinks can also include beverages like sports drinks, such as Gatorade, sweetened teas and coffees, energy drinks, and even fruit drinks marketed to kids like Capri Suns. So all of these sugary drinks are really taking a huge toll on our kids' health. Unfortunately, 1 in 3 kids born after the year 2000 will statistically develop diabetes in their lifetime, and it's 1 in 2 Latino kids. Each sugary beverage that you consume every day increases your risk of diabetes by 18%. And people who drink more than 2 sugary drinks a day have a 31% increase in the risk of developing heart disease. Here in Boulder County, unfortunately, 25% of our kids are experiencing overweight or obese, and that number is just growing every year.
That is shocking. That's amazing, and it's a tragedy. And just to paraphrase what you said, all drinks, all commercial drinks have sugar in them. Whether there's, some of these companies market this beverage as healthy, like an orange juice or an apple juice, and we drink that thinking we're being healthy. Some of these vegetable mixtures, and in fact we're not. I mean, all you have to do is look at the nutritional value label, and you will be surprised how much sugar there is in those drinks. And I think that is part of the tragedy that companies market, and they spend a lot of time and money convincing us to buy these drinks, and really, they're not healthy for us.
You are 100% right. And it is sad that when people reach for juices, they think they're doing a good thing for their kids or for their own bodies. But you're right. When you take all that fiber, you're left with basically sugar water. There's less chemicals than Coke or any soda, but just as much sugar in it. It reacts in your body exactly the same way.
And I would say, we're talking about sugary beverages here today, but that also applies to other foods, cereals or, pancakes or anything really that comes in a box. That's also looking at the nutritional value. You can see that there is a large amount of sugar in there.
Yeah, absolutely. Most of the packaged food that we buy in grocery stores have sugar in them, whether it's salad dressing or frozen pizza or peanut butter. If you look on the nutritional facts of almost anything you buy other than whole fruits and vegetables and grains and beans, then most do include sugar. You're absolutely right.
Yep. It's fighting a marketing, monster. They spend millions of dollars because that's what they're supposed to do. And we just have to learn ourselves what the right and the better thing is to do. So with that, what is Boulder County doing about, to help us reduce sugary drink consumption?
Yeah, well, because we want to make sure that our community is a great place for kids to grow up to be healthy, we're working on 2 projects that are spreading awareness and also trying to nudge behaviors. So the first thing we're doing is we're trying to pass an ordinance here in Longmont that will make healthy drinks like water or milk the default beverage on kids' meals. So kids and parents can still order absolutely anything they want, but it just makes the healthy choice the easy choice. And companies like Disneyland and McDonald's have already tried this, and it's been very successful to boost healthy drink consumption for kids. So secondly, we're working with a group of truly phenomenal Boulder County high schoolers to create a social media campaign that highlights the harms of sugary drinks to kids. So they've been spending time researching how sugary drinks affects the body, how sugary drink companies unfairly target kids in communities of color. And now they're launching a social media campaign to teach their kids, their peers, what they've learned. So Daniela, would you like to share more about the campaign?
Yeah, of course. So we've been we finally are in the works of posting our research, and all our research is, about structural racism, about what effects it has on our body, how much a drink has of sugar per ounce, the tactics of commercializing these sugary drinks. And so we have a TikTok and an Instagram account talking about that. And we're planning on posting more about it. And so
So Danny, let me ask you a question. What kind of tactics, what do you see that these companies do to reach the youth, or maybe the Latino minority community specifically, than they do with other communities?
Yeah, so one important thing is that they use celebrities, especially celebrities of color, and to be like, hey, that's someone like me on a commercial, they're drinking something, maybe I should drink it. Also, colors is a very important thing, and how the colors are very vibrant, very much attract the eye. And so many times, let's say, for example, Coke and Pepsi. Coke is red, a very vibrant red, and that's the main color. So it attracts your eye very easily. And Pepsi, it's a very vibrant blue and very vibrant red. So again, it attracts your eyes easily. And also the color coordinates. So it's a very patriotic colors for Pepsi. So you just think of, that right away. And another thing is how low the unhealthy drinks or unhealthy food are at for the children's eyes to view it. So it's much easier to see that rather than seeing some fruit or some actual healthy drinks like water. And even then, when you look into when you're stopping next in line to pay for your stuff, they have right next to you a whole bunch of drinks and very little water they can get easily. So there's so much free access to that, and then you're not able to see the actual healthy things right away.
Well, how sneaky they are. They get you on the things that call your attention, like music and celebrities, and even, which is not very known, in the shelf space. And you're right, the lower they are, it attracts kids, right? And for adults, they put them at eye level for the things that the marketers want them to buy, because that's what they see first. So thank you for sharing, Danny. Okay, so back to you, Christina. You said there were 2 things that the Boulder County is doing. Did we talk about the second one yet?
Yeah, exactly. The social media campaign that Danny was talking about. Yeah.
Excellent. So then, what can we do as individuals to help, deter this tragedy?
Right. Well, one huge thing that you can do is just talk to your kids, the kids in your life that your own kids, grandkids, your friends, why sugary drinks are so harmful to their health. And the 28 highly advertised sugary drink brands, 11% specifically target Latino children. And from 2010 to 2013, spending on Spanish language TV advertising for sugary drinks and energy drinks increased by 44%. And as a result, Latino youth are 93% more likely to visit beverage company websites like Coke websites. So that's one big thing, just to let kids know that they're being targeted, especially if they're youth of color, double that. Also, if you own a restaurant, considering offering unsweetened healthy drinks with your kids' meals, or one Longmont restaurant owner even successfully just moved his fountain drink display from right next to the counter to farther away so that it wouldn't be the first thing that kids saw. And actually he got a lot of really positive feedback from parents about that, because their kids were filling up on sugary drinks before they could eat their food. So there's a lot of wasted food and unnecessary sugar and calories for the kids. So I think collectively as a community, we can absolutely work to ensure that our Longmont kids grow up to be healthy adults.
Wow. So let me ask you, a question that, listening to all of this, the focus obviously here is on kids, because if you start a habit when you're young, it goes to adulthood and you become healthier as you grow. What about adults?
Yeah, well, of course, we're in the midst of a huge epidemic of heart disease and diabetes and obesity. And, really, people look at personal choices, right? That's the first place people often go to in their minds. And that has something to do with it. But the obesity and just all these chronic diseases really started picking up in the 80s. And you have to wonder, what happened then? Did people suddenly lose their self-will? And of course, that's not true. Our food environment changed, and processed food became much cheaper and more widely available. And food companies became more and more savvy about even using fMRI imaging to look at our brains to see what really lights up our brain for pleasure centers, for just getting the exact amount of sugar or salt or fat right, or even with advertisements. So the food environment has changed, and so we got to do what we can to reverse these really terrible trends that are creating so much suffering and early death by working to change our environment through things like the ordinance that we're trying to pass for kids that do change the norms, that say we should be drinking water for our healthy bodies, and also education. So to that end, we really appreciate you having us in this interview today to kind of spread our message.
Well, and thank you for being here. This is such a powerful message, and I hope a lot of people hear it. I mean, from my experience, what I hear that we all need to know, it's like we need to move from the I don't know to the part that says, now I know a little bit more about health. Health is it's a lifestyle. It's not something it's not like going on a diet that has a big beginning, middle, and an end. It's a way of living. And if you realize that sugar is not good for us, at least not in the processed form that we drink it or eat it everywhere we go, is bad for our health. And we do feel a lot better with less of it. So thank you guys for sharing this. I'm going to put Christina's information and her program's information down here in the description, so you guys can learn more about this and contact the department if you have any questions. Let's move towards a healthier Boulder County. So thank you guys for being here. Before we go, I have a surprise question for you guys. Are you ready?
Yes.
All right, Danny, you go first. What is your favorite word?
My favorite word, I would say jewelry. I can't say it, but it's a fun word to say.
Agreed.
Jewelry. Okay, at least you didn't say sugar. Thank you for that, Danny. Okay, Christina, it's your turn. What is your favorite sound or noise?
Oh, that's easy. I'm lucky that my two kids are best friends, and so I hear them laughing together all day, and so that nothing makes me happier than that.
Excellent. Well, thank you for sharing, you ladies. And with that, until next time.
Thank you so much.
Thank you.